Now let's jump into the topic SMART, right? We all know it's an acronym. Gary is going to define it, so I'm not going to define it for you right now. But having been in this profession for 17 plus years, working with dental practice owners, I know every single one who has created a very successful practice. I've seen practices go from literally like a startup all the way to $5, $6, $7 million, from a single location to 4 locations, 6 locations. You know, and they use this practice as a wealth generating engine. So the common thing I notice with all these practices is at the beginning of year, they know clearly what are the 2 or 3 things they're aiming for that year. And they're very crystal clear and it's very specific. It's not like, oh, I want a better year. It's very, very detailed and specific. And there are the deadlines and dates, and these are all part of what a SMART goal is. And that seems to be a common characteristic of every successful dental practice owner. And I think that's true for any business owner, probably for any human being, like, even a child who wants to get into a university and let's say wants to get into a competitive university, probably has a specific goal. I'm going to get into this university, or here are the top 10 that I'm aiming for, and I at least want to get into 3 of these, right? So they're very specific. There's a deadline, there is a method to the madness, and then they work on it. They figure out like what do they need to do to accomplish it. In some cases, you get help, you get somebody else to help you with something. You put a timetable, you work on things. Anyway, so it's going to be a wonderful episode. Gary, please take it away.
Yeah, one of the things I've observed, Naren, is very often dentists throughout their career leading up to practice ownership have been very goal-oriented. You had to be goal-oriented, going back to even high school. In high school, you wanted to be able to get into a college, an appropriate college. In college, you had to be goal-oriented to either, get your grade, your GPA at a certain level, so that you can get into dental school. Maybe a subcomponent was that you wanted to take some preparatory courses for the DAT. So you had a goal of taking these courses for the entrance exam for dental school, the DAT, so that you could have the highest possible score, that you could get on the DAT. And then, of course, you wanted to not only survive dental school, which can be a challenge by itself, but you wanted to learn as much as you could so that when you graduated, you would pass the boards, another goal. And then for those of you that had the goal of owning your own practice, there was a whole nother series of things that had to happen to own your own practice. And then I noticed that a lot of doctors now, they become a practice owner. It's like, okay, here we are. Yeah. And the goal process peters out.
Right. And Let me ask you this, Gary. You have coached or worked with hundreds, if not thousands, of practices over the last 44 years. Do you feel what percentage of practice owners are as goal-oriented as they were when they were young and going to school? Is it like...
Well, I think I have a bias there, Naren, and the bias that I have is that doctors that use coaching tend to be those that are predisposed to be goal-oriented. So in other words, I am interacting with a segment of dentistry that tend by self-selection tend to be goal-oriented.
You're saying they have very specific targets in mind for that year, for the next 3 years, and they leverage your capabilities to help.
Well, it may not be numbers, Naren. Like, for example, let's tie it back to that upcoming masterclass we have. Maybe a goal they have, is to take this practice that they bought that maybe wasn't relationship driven. Maybe, in a very simple sense, practices when it comes to their style of practice, very simple. This is maybe overly simplistic, but they're either relationship driven on one end of the spectrum or they're transactional on the other end of the spectrum. Think about a continuum with the line where one side is relationship driven, the other side of the line is transactional. By the way, the practice Paul and I bought in May of 2007 was very transactional. Didn't have to stay that way because we weren't about to leave it there. We wanted to do something about it. But I think there's something about maybe a little bit of goal fatigue sets in for dentists because of how much effort they had to put in to get to become a practice owner. Maybe they experience a little bit of goal fatigue. And I think they sort of think that now that I own this, it'll naturally evolve into my practice of my dreams. But I'll give you a sneak preview. That doesn't happen. Now, I do need to give a true confession here. And anybody that knows me knows this to be true. I am OCD on goals. I'm obsessive compulsive on goals. I have been since I was born. It's in my DNA, and I can't imagine not being that way. And I have to learn when to dial it down. I have to learn that. I have to use my emotional intelligence, especially when it comes to leadership, to embrace cooperation among goals. So it's not just me. But I'm very goal oriented. I can't do anything without having goals. And that's just me.
Yeah, you mentioned perhaps the reason why they are not goal oriented post, getting the dental degree is maybe the fatigue. Perhaps another reason could be up until that point, all their goals, they could completely control it, right? What they get in the DAT, it's up to them, right? How much hours they put in, what prep class they took, it's 100% within their control. But the minute you become a practice owner, you can't do it alone. And that's a transition, not, again, I have front seat access to some of your coaching work, and I notice the ones who are crushing it versus others who are still a work in progress. And I notice like the successful ones are able to not only create goals for themselves, but also create goals for the team.
Well, here's an insight here, and maybe
Yeah.
I'll amplify on what you're saying.
Yeah.
Up until you graduate from dental school, dentistry is a solo sport.
Right.
It's solo. You're playing.
Yeah.
You're. It's a solo sport.
Right.
It's like running a race by yourself. You don't have. I'm not talking about a relay race. You're on your own.
Right.
However, having a successful practice is anything but a solo sport.
It's kind of like
a team sport.
Yeah, it's like being a child versus an adult, right? Child, you're only responsible for yourself. Adult, you're responsible for your kids. You're responsible for your company or wherever you're working. You start becoming responsible for and with others.
And maybe that's why there's a lot of dentists that actually are very, very accomplished dentists in their clinical skills, but have mediocre practices. Because the pursuit of CE, the pursuit of clinical excellence remains largely a solo sport. And then they haven't been able to translate that to a team. The truth is you can do dentistry by yourself. Doctors, you all did that in dental school. Largely, you're doing dentistry by yourself in dental school.
Right.
Yeah, it can be done by yourself. However, I'm going to politely say you cannot have a thriving practice by yourself. So with that said, let's get into this SMART acronym. So I can't remember the first time I was introduced to the acronym SMART. I believe it was some work I was doing with Stephen Covey. My memory is that I believe it was something that Dr. Covey, Stephen Covey, introduced to me. SMART. SMART is an acronym. It's a clever word, but it's SMART goals sounds good, right? Well, I'm have SMART goals, but more than that, it's an acronym. And let me explain what the acronym means. SMART. It means specific. S is specific. M is measurable. A is achievable. R is relevant. And T is time bound. So any goal we set in the practice, I'm going to suggest needs to follow the complete acronym of SMART. It needs to be specific, measurable, achievable, relevant, and time bound. The likelihood of achieving that goal is much better when you define it in a way that meets those objectives. Let me give you an example of a goal that is not following the SMART acronym. We're going to make this year our best year yet. We're going to make this our best year yet. Now, that goal is too vague. It doesn't meet the definition of a SMART goal. So if it's specific, it's something very, very specific. So first of all, it doesn't meet the specific goal. What does that mean? Does that mean we saw more patients this year? Does that mean we produced more than before, make our best year? Does that mean we did more cosmetic dentistry this year? Does it mean we collected more this year than any other previous year? What does it mean? There's too many variables to that. Does that make sense, Naren? It's got to
Yes.
be specific. And that's where a lot of goals fail. Another example, we want to do more whitening. A goal is we want to do more whitening. What's the problem with that goal, Aaron?
Was it one more, two more, three more? Like it's not specific, right?
By
Uh,
when?
yeah, exactly.
By when? So specific, obviously self-explanatory. It needs to be something very specific. And the more narrow you can be on that one, the better. And you can have a bunch of SMART goals. But the more specific you can be, that's self-explanatory. It's something very, very specific. Measurable. It's something that we can measure, that you can analytically, quantifiably, objectively measure. I want to have a better practice. What's measurable about that, Aaron?
Uh, you want to have a better practice. It's not measurable, right? Like what does it
Nothing
mean?
is measurable about that.
Yeah. Yeah.
I want my marketing to be better. What does
Yeah.
that mean?
Not measurable.
It's not measurable.
Measurable. Yeah.
So it's got to be measurable. You have to be able to define it.
Yeah.
Things that are measured improve. So here's the trivia question for all of our listeners. Who first said that? Things that are measurable improve.
Was it Deming?
Bill Bowerman, track coach of
Bill
University of Oregon.
Bowerman. Okay.
Bill
Got it.
Bowerman.
Bill Bowerman.
And then he said he had a corollary to it. And if the measurement is reported back, the improvement becomes geometric. So it's one thing to measure it, but if you don't have a way for people to see it, then you're not going to get the full leverage out of it. If it's reported back, then the result can be geometric. Pretty cool thinking there. So it's got to be measurable. Next, it has to be achievable. This is where there's an art and science to setting goals, Aaron. Setting goals is a bit of an art and a science because you want it to be a little bit of a stretch over where we are. I mean, what good is setting a goal if we're already doing it? Let's just keep doing what you're doing. So you want it to be a little bit of a stretch, but you don't want it to be so far of a stretch that people deem it as unrealistic. People meaning your team members. If they think it's unrealistic, they'll resign. They resign the goal right there. Just never mind. We're not going to do that. So it's got to be achievable. It's got to be something. Should be a stretch, in my opinion. Should be something that is something we have to apply and reach for, not just show up. We've got to do something. But it can't be so far out there that it's deemed not realistic. Relevant means how does the goal tie into your overall perspective of your practice? Is it relevant to that? Does it relate to everything that we're doing? Is it relevant? Relevant is probably the most abstract of the four letters, but it has to be relevant. If we're out doing something, but it doesn't really relate to the success of our practice, then it really isn't worth the effort. So it has to be relevant. It has to pass the relevancy test. And then finally, time bound. Time bound is by when. The way to answer that is by when. We're going to do this by when. Now we have a timeline associated with it. So think about that. Make every one of your goals SMART goals.